Hey everybody, welcome to my channel. My name is Brianna and I am a licensed practical nurse. I have been an LPN now for about a little over a year. When I was a CNA, I used to make videos and I get questions from people that I know. So I thought it would be a good idea to just make this video to kind of just give my perspective after being a nurse for a year now, and to kind of explain what a LPN does and just to give my perspective on what an LPN is and just the career itself. Also, if you just want to get to certain questions, then you can look in the timestamps. I'll put them in the bottom. Okay, so like I said, my name is Brianna. I used to be a CNA and I went to nursing school and became an LPN last year. Yeah, I just wanted to answer questions for some of you all who just really don't know what an LPN is, or you're thinking about maybe going to nursing school to become an LPN but just want a little bit more insight on the career. Okay, so question number one, what is an LPN and are they real nurses? So to answer the question, an LPN is a licensed practical nurse. So yes, LPNs are real nurses. Not only are we nurses, but we are supervisors. We supervise CNAs and we delegate nursing assistant tasks. When you think of licensed practical nurse, you think of the word practical, or in some states it's vocational, and that basically means like skill, trade, practical, practice, practicality, like actually doing. So when I think of LPN, I think of the doing part of nursing. Not saying that LPNs don't think, but it's just the depth of knowledge isn't there because it's not required in school. So number two, what do LPNs do? As an LPN, I have done pretty much everything. We take vital signs, we bathe, feed, toilet, we change dressing, we can do IVs, we can draw blood, medication administration, which is like a big thing for LPNs. It's like a lot of our role is medication administration. That's like in different roles. We do a lot of medicine. We are responsible for supervising patient care in a lot of facilities. It just depends on what your role is. Where can LPNs work? So LPNs can work in a lot of different settings. I know I can just speak from my own experience just within the past year. Job opportunities that I've seen, job opportunities that I've had, interviews, just literally we can work anywhere that requires medical care, and not anywhere but a lot of different places. And this is just from what I know personally. We can work in long-term care / nursing homes, outpatient centers, doctors' offices, jails. Depending on the state, we can work in hospitals, we can work in home health, we can work in schools, we can work from home, we can work in urgent care, we can work in pediatric. It's like the doors, it's limited. We don't have as many doors open to us that RNs have, but we have a lot of different facilities and work settings that we can choose from. So what are the major differences between CNA, LPN, and RN? First of all, the big major difference between the three is school, and that's just plain simple. CNA, I think it was like 4-week program. LPN is 1 year and RN is 2 years minimum. The major differences between all three is just responsibility and depth of knowledge. Obviously, if you only went to school for 4 weeks, you're not going to know what somebody that went to school for a year knows. And same thing with RN. If you only went to school for 1 year as an LPN, you're not going to know everything that an RN knows who went to school for at least 2 years. So, I mean, it works like that in the actual field. When you actually work in it, works like that too. So your responsibilities is going to be based off of how much knowledge that you have. So one is not better than the other. Whatever role you have, you just have to know your role and work within your scope, period. How much money do LPNs make? Honestly, the amount of money that LPNs make really depends on where you live, what kind of facility or where you work, and like your experience. Like it really, all three could be a factor. One could be more of a factor. It just really depends. Like that's just like, it's not a one answer question. But I can just speak for myself. I live in the state of Georgia, and I would say if you're working just like a regular full-time 9 to 5 job, not traveling, not PRN, agency, none of that. If you're just working like a regular full-time, you know, hospital, three 12-hour shifts, or if you're working like a clinic, you know, Monday through Friday type thing, then I would say I've seen salaries are pretty much between 40 to 60,000. 40 being on the like coming in, like just now getting started in, and then like 60 being on the more experienced, and you know, more or less both, you know. But it just all depends on what you're looking for. And you know, a lot of nurses don't just have one job. We often have one main job and like a per diem job where we can just pick up shifts. Or, you know, some nurses work fully travel, fully contract, fully agency. So it just all depends. The money is just, you know, depends on you and your needs and all of that. Okay, so school. I've said that I answered this already in a previous question, but school for LPN is 1 year, not including your prerequisites. So it took me about 1.5 years, because it took me it took me 1 semester to do my prereqs, and it took me 1 year to get through the program. So yeah, that's what it is. That's what I've seen. I'm not sure in different states. I can just speak for the state that I live in, and you know, the different states that I've been you know, Googling. But yes, it's like 1 year. It's a year program. I hope that this video answered any questions that you have. If you have any more questions or anything that I didn't answer, please leave them down in the comment section. Please subscribe to this channel, and I'll see you all in the next video. Bye.